Hello, my name is Karen Libery. I'm a pelvic floor physical therapist. I wanted to educate you today a little bit about the pelvic floor and some of the reasons why you might be having the pain that you're having. So if we take a look at our pelvis, we have our hip bones, which is here where my hands are. If we look to the back, we have the last piece of our lumbar spine here. This is called our sacrum. Then we have our tailbone. Looking to the front, we have our pubic bone. And our pelvic floor muscles attach from our pubic bone all the way back to our tailbone. And that gives us the nice hammock of pelvic floor muscles that we sit on. In addition to those muscles, we also have lots of different muscles that attach to the pelvis itself. So if we take a look on the outside, down towards the perineum, we have the urethra, vagina, and the rectal opening. And on the outside, there's our external pelvic floor musculature. So as you can see, part of it attaches to the pubic bone, which is called our ischiocavernosus. And then we also have a group of muscles here called our bulbospongiosus, and then our transverse perineum muscle. This right here is our sits bones, and the reason why those are important is because this is where the hamstrings are going to come up and attach. If we look at the front, there's little bony prominences here, and this is where our hip flexors are going to come up and attach to. And then on the back, we have our sacrum, and there's a number of different muscles that are going to attach here, including our glute muscles and our piriformis muscle. And that's important because the sciatic nerve, if any of you are familiar with sciatica, runs right through that piriformis muscle. So as we can see, there are a number of different structures that come in and attach to the pelvis. One other very important structure is also it's called our transverse abdominis, as well as our other abdominal muscles. They come in and attach to our pubic bone right here. So the three main stabilizers for our spine are actually the pelvic floor muscles, the abdominal muscles, as well as the multifidi muscles that attach to our spine back here. So the three main stabilizers of the spine include the pelvic floor and abdomen, so that's going to be a really important part, especially if you have back pain, to know how to contract and relax those muscles in order to help to stabilize you. For those with pelvic pain, it's going to be important to realize that not only do we need to relax the muscles of the pelvic floor, but we also need to relax the muscles that come and attach to the pelvis, meaning doing a really good hip flexor stretch, hamstring stretches, piriformis stretches. There's another muscle, you're getting a real good anatomy lesson today, called your quadratus lumborum, which also comes and attaches in the back here. And the reason why these muscles and why they need to stay relaxed is important is because there are nerves that run through these muscles, so that if the muscles are tight, it can be pinching on the nerves, giving us pain. And pain in a number of different locations, whether it be the front of our leg, the back of our leg, or in through the pelvic floor muscles themselves. All of this can happen with increased tension of those muscles. So when you go for physical therapy, they will teach you a number of different types of stretches in order to help to relax all of the attachments to the pelvis, in order to help to quiet down the pelvic floor. In another segment, I will show you these stretches that will be important to do, as well as some relaxation breathing and relaxation positions in order to help to quiet the pelvic floor as well.